remember this sound. Yeah, this sound brings back so many memories.
Seeing higher than ever numbers of people presenting as homeless.
Well, on a given night, really, more than 3,000 people in the UK are sleeping rough.
And we, as a society, do not have the right interventions in place to even contemplate starting to reduce the number of people that are dying.
There are lots of services involved, whether that may be police, health, housing, care, and all the third sector providers. It's a complex system which, if it's not coordinated, that can just be another load of barriers for people to access it.
Care systems are disconnected and there is limited sharing of information and collaboration between professionals, and the result are poor patient outcomes and very much waste of money. My name is Michela Tinelli, I'm a health economist and I work at CPE, Care Policy Evaluation Centre at London School of Economics and Political Science. So I'm working on a project, Care Quality Evaluation, CQE, a modular digital platform to provide a continuous flow of information that can be analyzed real time, and from the analysis, visualization can be provided back to stakeholders to support the decision making. They can be service providers, local commissioners, local authorities, and also a national level, as well as the national charities. As an example, the People Recovery Project is a very exciting collaboration, and we are helping them to frame their successes.
The People's Recovery Project is a charity that exists to make recovery achievable and sustainable for people experiencing homelessness and addiction. Our organisation has community at the heart of it. It's people with lived experience that are contributing to the design of the organisation. It's people like COSRU that is so important to have involved.
I think I've been hospitalised over 50 times. I was paralysed through IV using. I was catching infections from, living on the streets and stuff like that.
Hello, could you possibly spare any change, please, sir?
This is the reality of living around here. The amount of resources that I used to spend on the NHS, imagine they spent 1/10 of that and put me into a rehab and stuff like that, things would have changed. Like now I'm paying my taxes. It's different now.
So if we can map their journeys, look at their cost to society, look at the cost of the intervention, and then look at their costs down the line. And ultimately, we want to use the CQE dashboard to evidence that and illustrate it, to take it back to national government and say, well, actually, we know that it works from our anecdotal evidence, but here's the solid, hard data to show you the impact of providing treatment to individuals when they are asking for it and when they want it.
I'm the Programme Manager for the Oxfordshire Out of Hospital Care Model, working with adults who are either homeless or at risk of homelessness as they come out of the hospital setting, so planning safer discharges. In the community, it's about trying to avoid admissions if they don't need to go to hospital, and overall to avoid rough sleeping. To do so, data is crucial. We use data to manage our day-to-day services. We also use data to evaluate our services retrospectively. So we intend to use the CQE dashboard to enable us to measure system-wide outcomes and to show what impact we're having, and really to help us build and commission integrated services. So having this data available enabled us to put a robust business case to our funders, and we were able to show the value and the impact that our work delivered across multiple systems with us: housing, police, health, care.
How are you? Thank you. How's it going?
Oh, it's out now, see?
The dashboard enables me to manage the service in real time. I can respond to fluctuations in demand and capacity and performance management metrics to really respond in an agile way.
So many times care is very much provider thinking than one size fits all, but an individual patient level data can be used to make population level changes.
I really needed help. 7 years have passed now. I'm married, I've got a child, I give back to the community that I took so much from, and I'm in a path and I'm trying my best.